So, good evening, everybody. Welcome again to this monthly webinar. Today we'll just be talking about everything public health. And today we have Dr. Clifford with us, who is a public health practitioner with us. And we'll be looking at everything public health and looking at all the questions that sort of come through from the registration form. So, we'll be broadly looking at the general public health landscape, then what are the career pathways that exist after MPH? Because especially for those in the UK, it's a big challenge on what do I do with my MPH degree? How do I even navigate the process and all of that? So we're looking at different career pathways, then thinking of the transferable skills or what makes you very marketable in the public health space, what those skill sets are, then how do you go about looking for jobs, searching for jobs, and networking with people? Then he'll be sharing a bit of his own personal challenges about how he sort of got his own role, which sort of leans back into how do you even navigate that journey. Then we'll look at the career transitions into public health, then the place of certifications, CPD, and career development in public health space. So again, it's not just us. So this session is about you guys. So if you have any questions, feel free to, raise your hand because we'll be having a Q&A session after this for him to also answer some of the questions that you might not have answered or put up in the registration form, if that's all right. So if you are not happy to speak, you can pop it up in the chat because we'll be monitoring the chat to pick up questions from there. So I hope that's fine. So by way of introduction, Dr. Clifford, I'll probably leave you to just introduce yourself briefly before we just kick off.
Thank you so much, Dr. Ron. Such a pleasure to be here, and it's really nice to have this opportunity to speak with people and talk to people about public health in the UK. I know it's very in recent time we had quite a lot of talks and opinions about what public health is and is not, and how what the opportunities are, in public health in the UK. But that's why, Dr. Ron and I, he's made this, and I'm happy to join and be a resource person here. So my name is Clifford. I'm a medical doctor both in Nigeria and the UK, that I'm licensed in both Nigeria and the UK, and also I'm a public health professional. Currently, I'm a senior public health practitioner in one of the local authorities in the United Kingdom. And I have quite a length and breadth of my experience as as a public health person from even from Nigeria and also in the UK covers quite a range of areas. So um that's me in a nutshell, and I'm really very happy to share my insight and help everyone here as much as I can, to the next level and answer any bothering questions that we have. Thank you so much.
All right, that's fine. So let's start off. So probably kick off by looking at the general public health landscape. So one of the
Yeah,
questions I got was, what are the core domains or what are the sectors within public health that we have? So even
yeah.
personally, I know we have things like health promotion, there are things around epidemiology. So could you just sort
Yeah.
of expand on that a bit?
Okay. So, contrary to what a lot of us have learned from, I'm assuming, or I'm hoping that quite a number of us, if not all of us here, we've done or we've gone through the Masters in Public Health or MSc Public Health in the UK, because the UK public health system is a little different from what we have in Nigeria. It's not totally different, but it has its own peculiarities and is very structured for the United Kingdom. So there are three domains of public health in the UK. We have health protection, health improvement, and healthcare public health. So that on its own incorporates quite a lot of things. So I know quite a lot of people will say, "Oh, what about epidemiology? Epidemiology sits at the bedrock for everything because that's what gives you, the would like to say part of the evidence base for whatever you need to do. A lot of people say, what about data? What about data? Every domain in public health uses some level of data. So the three main domains of public health in the United Kingdom are health protection, health improvement, and healthcare public health. Health protection, like the words, like it's very quite explanatory, is protecting health. So everything that has to do with what are the measures that you can put in place to protect or preserve people's health, you know, it's that's what is health protection. So things like vaccinations, things like emergency response, pandemic control, outbreaks, disease outbreaks, and all of that. So in itself, most of the time, epidemiology sits under this as the core because that's the foundation for whatever it is with regards health protection. Now,
Mhm.
health improvement is the part of health, the domain of health that is very, like I said, is improving health. And the crux of it is how do you address inequality? The only reason why we want to improve health is because we recognize there are health inequalities. So most of the things, programs, intervention, policies, everything that is geared towards ensuring that health inequalities are reducing or are reduced, among populations, communities. That's what health improvement is. Now, healthcare, public health. Now, the third domain is very jet. It's more or less, or it's the part of public health it's more clinical. It's in the hospital because we have yeah, so it's more clinical. It's a part of public health that is interfacing with patients, patient relative, and all of that. That's what are the things you do in the hospital with regards to public health. So that's the three domains of public health. Now, the three domains of public health in the UK, if I could backtrack a little, public health in the UK, why I said it's quite very, very interesting or it's different is that it's run between the local authorities, the NHS, and the bridging between the two. So we have some national bodies like the UKHSA, OID, Office of Health Improvement and Disparities, that are also looking towards the different aspects of the domains. So primarily, health protection sits with the UKHSA, that's the United Kingdom Health Security Agency. They are the four organization, the foremost organization that deals with ensuring that all the different parts of the country, are protected. And they delegate some of the duties to the local authorities. The local authority is usually where health improvement really sits at. Also having a crossover with the OID, that's the organization, that the Office of Health Improvement and Disparities. So anything that has to do with health inequalities, the local authority does the bulk of it with OID. Then healthcare public health sits majorly with the NHS, the ICBs. So that's how a crossover is in public health. So in all, I'm just going to do like a summary of all of that: health protection, health improvement, and healthcare public health. Those are the three main domains of public health in the United Kingdom.
All right, thank you very much for that. I think it's really interesting to get that structure and clarity. So even though, yeah, it's public health, but different countries sort of run things differently in terms of how they've sort of structured their own. And for
Yeah,
people who are keen on, breaking into the public health space in the UK, it's very important to understand that distinction. So
yeah.
next question is, how do roles differ between academia, government, NGOs, and the private sector? Yes, it's public health, but how
Yeah.
does this cut across these four different areas?
So the roles, so the whatever part of public health you're in, determine what kind of roles will be available. So, because there are different employers within the public health space, there are different employers. So we have the local authority as one employer. We have the NHS as one employer. We have some call them charity healthcare health focused charities that are also employers. We have private institutions and NGOs, foundations that are also employers. We have the national bodies like the UKHSA, OE that are also employers. So the different employers of labor in public health infer what type of job roles you want to get. Although I tell people quite very early that if you're early entry, if you're starting your career, maybe you're just finishing your masters or you're just trying to transit at the early stage or maybe mid stage, I would say don't be very fast to specialize in that way. Don't be more of a generalist because if you specialize quite early, it might be very hard to get into some roles, except for very few occasions. There are no absolutes in medicine or public health or whatever it is anywhere.
Mhm.
Apart from very few occasions where, you can really be that special, you can have that special interest, maybe special interest in health protection, health improvement, what in healthcare, public health, but really to have that length and breadth of, of opportunities early on, I would say be very open to all the different employers. The local authority, yes, employees, especially when it comes to health inequality. So if you have that flair for it, or you have that exposure towards that, I'll say, okay, apply it to the local authorities. If you are very clinical, you have that, crossovers for clinicals, and you want to see how, patient care is affected by public health, the NHS, ICBs are very good employers for that. If you're, you want also to do a lot of policies, with regards whatever domains of public health, I'll say go for the national, you know, bodies. Then charities, if you're very jet towards also inequalities, or regardless of whatever, focus that charity is, if you're very jet towards it, I'll say, okay, go for the charities. Then for private institutions, especially foundations, they're very driven by topic areas. So maybe um like the Gates Foundation, for example, maybe it's an area like malaria, HIV, so those are very topic areas. So it depends on what your interest is. You can have you have a wide range of employers to go for. But I will also say this and reiterate this: please don't be too fast to be very open to any um experience, any employer of public health, because I think that gives you the length and breadth for your skills, so your knowledge, your competencies, especially starting out from from postgraduate, masters in public health.
Okay, thanks for that. So this leads in neatly to the next question, which is around so the difference between working like for the global bodies like the maybe UNICEF, the WHO, UNDP, and all of that,
Yeah.
versus sticking to within like national remits, like let's say the NHS or UK or local authorities. So what's that difference like?
So I think the only difference, public health, regardless of where you're working, whether national, local, regional, international, world bodies, they 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 have the same common underlining principles and skills, knowledge, competencies for all of
Mhm.
them. Now, the only difference usually is always the focus of the focus of the organization. So while national bodies, local and regional are very geared towards, UK math, anything that has to do with the UK or the priorities that are very important to the UK, global bodies like the WHO, UNICEF, United Nations, they are it's an international body. So it's the range of focus for them might differ significantly from the United Kingdom priorities. Not
Okay.
to say that it's not a bad or good, it's not that kind of dichotomy. It's really about what are the priorities in the world now at the moment, especially if you're going for those roles in the world, in the world organizations, international organizations. So it depends on what your interests are and where you want to get to. That will determine, where you face. But if you're very, you're in the UK, you really want to work with, you know, the priorities of the United Kingdom, I would say, okay, go for any of the local, regional, or the national bodies. But if you're very geared towards global health, international health, the priorities across the world, in Asia, in America, in Africa, I'll say, okay, go for international organization. So that's the major difference or differences between them.
All right, that's fine. Thank you very much. I don't know, for those who's just joined, we've kicked off, and don't worry, the recording will be available. So we're just trying to look at, what's the broad scope of the general, public health landscape, the differences between, the different areas of public health. So let's look at the career pathways now. So this is where a lot of people sort of get stuck. So what are the common entry roles? So if I was just like a brand new MPH graduate, so what are the common MPH roles that I can sort of target, bearing in mind that maybe not every role might be open to me based on, the level where I'm coming from and all of that.
Yeah. So I usually would tell people, I would say there are no heights, or there's no limit to the height in which you can shoot from. You can shoot to from MPH.
Mhm.
There's no height. You can really shoot as high as you can. Of course, there are some specific roles, especially apart from maybe public health principal roles and some managerial roles. I would explain why I said some consultants in public health and director of public health that are quite very exclusive. every other role in the United Kingdom, you can actually get them from, your MPH. Now, the caveat is how do you evidence the competencies for those roles? Because
Mm-hmm.
it's a thing of you evidencing. It's that simple. It's never really about the qualifications. It's not never really about the masters. And that's a truth. I know a lot of us have come to the country, and there's so much emphasis on the masters, and that's because where we come from. I'm hoping. I know majority of people here will be people from Africa, from Nigeria. Maybe if you're not even from Africa or Nigeria, even outside maybe Asia, the emphasis usually will be doing a master's in public health, an MSc, MPH. Once you have that, it's like it gets your right to work in the public health space in the countries we're coming from. But in the UK, it's not really
Jona
that.
su sai ka yi exercise ko ka boka su.
Sorry.
Can you mute, please, Brenda? Go ahead, Clifford.
Okay, yeah. So, in the UK, it's quite very different. Not necessarily you having the qualifications. The qualifications are usually like an added advantage. They're not, and they're like, some parts it might be essential, it might be desirable, but it's not. Without that, you can actually get those roles. So what you have to do, or what I've seen, I've seen over time is we don't know, a lot of us don't know how to evidence the competencies and the skills. And
Mm-hmm.
that's why we are limited by the kind of roles we can go for. Because the United Kingdom is very competence and experience based, especially in the public health space. It's can you do the job? Have you done the job before? Can you replicate what you've done before? And if you cannot, it will be very hard for them to trust you you would do a great job. So it's a thing of you evidencing competencies, skills, and knowledge. That's what you have to do. And you can only get that with experience. So I've had questions, people tell me, oh, I already have, experience in Nigeria. Yes, it's always good to have the UK experience, but usually if you can evidence your experience, because I've had people that get jobs, public health roles right from Nigeria.
Mm-hmm.
Yes. So you just have to be able to know how to evidence your skills, your knowledge, your competencies, and that will get you the role. So there are no rules that you cannot hit for. So what are the roles now? So we have, I kind of wrote them out somewhere. We have public health officer roles, public health practitioner roles, health improvement officer, health protection officer, public health project support officer, public health program support officer, public health project officer or project manager, public health program manager. We have public health data analyst, or what you now call public health intelligence, program coordinator. So there are different roles that you can actually aim for. Let me look if I've missed anything else. Yeah, data scientist, health improvement, health, public health practitioner. Yeah. So those are different roles that are available in public health. Now, I've said all of these roles specifically with regards local authority. If you go to the NHS now, we have some rules because like I said earlier on, the NHS is quite very geared towards healthcare public health. So that's more about patients, patient relationship, how do you interface with patients with regards public health from the public health lens. So we have, patient engagement officer. Yeah, it's a public health role. We have tobacco dependency advisor, smoking cessation advisor. Those are roles in public health because they're all related to public health. So it depends on exactly where you want to get to. And a lot of us have the competencies, we have the skills, we have the knowledge for those roles, but we just don't know that those are the roles that we should aim for. And we don't think we have, and we don't do enough work to evidence the competencies for that. So those are the available roles in public health, really, both in the local authority and in the NHS.
What in the academic, environments, maybe universities and all of that, do we have roles that people can
Yeah, so
fit into?
there are quite a lot of research assistant, research officer roles, especially because the academia is research based. That's what academia is. So especially if you're not a lecturer yet, or you're not a professor, you've not. But if you're in that space, we have quite a lot of public health research roles. And actually, outside in the academia, there are quite a lot of public health research roles. So those are the roles that are available in academia. and the ones I talked about earlier that are outside of academia in the industry, if we can put it that way. So, so it depends on exactly where your focus is and how if you want what you want and how you want to get it, really.
Thanks a lot, because this now makes a lot of sense in my head, because the NHS, when you go to the NHS, is like you're seeing some specific set of roles,
Yeah.
which, like you said, that tend to be patient facing.
Yes.
Because I keep seeing all those tobacco cessation advisor, smoking cessation advisor, uh, patient engagement
Yeah.
manager, patient
Yeah.
this one. So it makes a lot of sense now. Thanks for that clarification. So let's look at the skill sets that we need to get into this space. So as a
Okay.
first time applicant now, what would you say are the marketable skills that recruiters are looking for?
Yeah. So, usually in public health, I tell people because quite a lot of us we don't have public health in that sense as a background. We've come in from other places, and that's the good thing about public health. Public health draws from all the different, organized or experiences we have or background we have. So some people have some clinical background. Some people are nurses, doctors, pharmacists, physiotherapists, dentists. Some people are non-medics at all. So people psychologists. And that's the good thing about public health. It draws from all of those experiences and foundation. So usually what I do is I put the skills in three different domains. So I say, what are the um, personal skills? Now, personal skills, I put them as personal skills because I said I've made it to I've labeled them as personal skills because they are skills that regardless of wherever you are, whether you're in public health or not, everyone should have those skills. And those skills would be the transferable skills in public health because you can transfer those skills from wherever you're coming from into public health. So skills like, advocacy, skills like teamwork, time management and delegation, organization and writing skills, resilience, problem solving, communication and presentation skills, IT skills, team building, leadership skills. Those are skills that are very generic to any organization or any, different. You don't even have to be in public to have those skills. And those skills are the soft skills, what they call the soft skills, and they're the transferable skills in public health because they draw on it. You do a lot. You need to work with a team. You need to be able to delegate and manage your time efficiently. You need to learn how to prioritize. You need to know how to write. You need to know how to be a problem solver. You need to know how to communicate. You need to know how to present. You need to have some level of IT skills. There's this is 2025, so you should know a decent level of IT, and you should be able to, work with a team. Like I said, teamwork, team building, leadership. Those are skills that are very generic. Now, when we come to public health skills, that are quite very specific for public health. We have skills like they're quite technical. So we have things like analytical skills, data interpretation, policy formulation, interpretation, commissioning and procurement, quality improvement, project management, program monitoring and evaluation, community and stakeholder engagement, health protection, health promotion, advocacy, political awareness, adaptability, social and cultural awareness, partnership and collaboration, research skill. Those are very now technical public health skills that, you know, that kind of differentiate or makes you, those are things you really need on a day-to-day basis in public health. Now, when it comes to the United Kingdom, there are quite some things that are quite very specific for the UK. And if you're going to work with an international body, you might not need them. You might not. But if you're going to work with any organization, especially local authorities, NHS, you want to know what the structure of the local authority is, what the governance structure of the NHS is with regards to ICBs, ICS, the ICPs. You need to have an idea of what they are. You need to understand how, local authorities, the local council, what the public health rules and processes are. You need to know that the lead public health official in the local authority, director of public health, that's the person that's answerable for anything public health in the local authority. You need to know that. You need to be familiar with the public health outcome framework, the Mammoth principles for health inequalities, have an experience and understand what an health needs assessment is, what a service review is, what are the governing public health rules, code of conduct, regulations in the UK? Where do we get data from in the UK with regards fingertips? What are different data sources? Those are things that are quite specific for the UK. So I put them in three different places: the personal skills, the public health technical skills, and the UK specific skills. Now, as an entry person, the chances for you having all of them is very slim. And that's the honest truth. If you already have all of them, then you should be a director of public health consultant at the time. But one of the things is showing, like I said before, how do you evidence your experience? A lot of times, whenever whenever you're trying um to show yourself for a role, you're not only talking about what you have done, you're also talking about the potentials you have. So it's how you're able to write it and showcase those things that will set you different. So sometimes some people, when they see your supporting statement, they know you don't have all of those skills, but they are ready to take a chance on you because the way you've written your supporting statement is in a way that shows you are ready to learn on the job. You are very receptive to learning. You're a fast learner. You're adaptable. You're teachable. And that's what sometimes it matters. But it's the way you write, and evidence your skills, knowledge, and competencies that set a difference. So those are the skills that are, all through entire public health.
So looking at just a bit about on the
Yeah.
technical skills. So like you said, not everybody would have like all the technical skills required to, get your hit the ground running when you
Yeah.
sort of start.
Yeah.
And again, your supporting statement plays a role in terms of how you sort of package yourself, trying to show
Yes.
I'm happy to learn, I'm willing to learn and
Yes.
pick up. So at the end, when you look at all the technical skills now, are there ones that like really must have, bearing in mind that yes, we can't have all of them, but are there some that you think that are really must have that people
Yeah.
need to sort of say, okay, yes, I don't have this now, and it would be nice if I could just invest some time or resources trying to pick up this particular skill set.
Yeah. If you ask me, I would say being analytical, that's knowing how to, analyze data. And in that, when I mean data, I'm not talking about the deep data analysis skills. I'm
Yeah.
talking about, can you read trends? Do you understand figures in public health? So
Mhm.
usually for most okay, maybe I'll just say this ahead of time because I don't know if this question will ever come up. But when you're going for if you go the application, the recruitment process for public health, sometimes it's in three different phases. Sometimes it will be just an interview alone. It will just be you and a panel of people, asking questions, you reiterating what you've written already in the supporting statement. Sometimes it could also go a step further. It could be a competence test. So they could give you like a graph, they could give you figures, data, just to interpret, on spots, just spot diagnosis or spot, not necessarily you call it spot diagnosis, but just looking at, data, graphs and interpreting it. You should have that level of understanding of data, of analysis. If you see a trend, maybe vaccination rate is going down. You see disease, going up. You should be able to tell what the difference is. You should be able to spot things. Having that level of analysis, and making a coherent conclusions from things like that. That's very important because those are things that it could be, in your competency test, in your recruitment. Sometimes, they can also tell you to make a presentation and to tell you, okay, this is a topic, maybe something in the United Kingdom. How do we, those are things also looking at how much you're able to think, apply principles from, I'm sure a lot of us have done a master's, from public health. What are the principles of public health that you can base your logical conclusion, solutions to, to different health issues that you can perform. Those are things that will come in very easy. So I would say very importantly, analytical and data interpretation is a very important skill. Another important skill is community and stakeholder engagement. Public health, you can't do public health in isolation because public health is never for you as a professional, it's usually for the community.
Yeah.
So if you're going to, prioritize the skills to have, how do you engage with the community? How do you speak with stakeholders? Do you know the levels of the communities? Do you know how the power imbalance or the power interplay is in the community? How do you speak with stakeholders? How do you get stakeholder buy-in? Those are things that most often than not always in the essential desirable qualifications usually, criteria. So it's very important to have those skills. Skills also, social and cultural awareness. The United Kingdom is quite very inclusive when it comes to public health. So there's a lot of things about understanding what a community is. So it can be a geographical community, it can be um, a demographical community. So you need to understand what are the social and cultural intricacies with dealing with different communities. Those are things to have very high up in our in our arsenal. Another thing again is research. It's very important because by default, if you've done a master's, you've done a dissertation, you know how to research.
Yeah.
Now, the thing about it is the rigor of research in academia is quite different from the rigor of research in the industry. But the most important thing is, are you able to make an informed decision of your policy or intervention based on the evidence you have? Can your evidence support? Is there a best practice from somewhere else that has been done somewhere else that you can replicate here? Those are the things that they want to see. You've been able to talk about, I've seen this being done somewhere else, in the UK, maybe outside the UK. And if we do it here also, we will see almost the same result or even similar. It's just having those. So in my mind, if I'm to write a supporting statement or if I'm to prioritize, I'll say my analytical and data interpretation is very important. My social and cultural awareness very important. Research, and finally, partnership and collaboration. As good as you can be, or as brilliant as you can be, you cannot afford to work alone. You have to work with people. And one of the things that it's very important that you see in job interviews is, have you collaborated before? How did you collaborate with people? How did you work in partnership with people? So it tells you that those skills, that skill especially, is very important to have. So if you're to prioritize, I would say those 4 skills are skills you should have, Andy, or you should be able to, have examples of evidencing those skills, really.
Thanks a lot. I think some questions are beginning to pop in.
Okay.
So even though I'm not in public health, I think this is now beginning to make a lot of sense based on all the questions I see, back and forth. What do we do? What do we prioritize and all of that? So if you've got any questions, please just put them in the chat. We'll have a Q&A sessions where we'll, take all of these questions. So let's look a bit about on how to actually find jobs, because
Okay.
that's another tough area or painstaking area that people struggle with. What's
Yeah.
the best approach? How do I even look for the jobs? Where do I even find the jobs? How do I apply? What
Mm-hmm.
strategies work? What doesn't work really? So
Yeah.
I know you shared a what I call it approach the other time. So can you just walk us through what you think is the best approach, how to look for a job? I just finished my MPH and I'm looking for
Yeah.
my first job. So how do I approach job search?
Yeah. So, first things is you would need to recognize where the jobs are. Yes. And like that's why I said from the very beginning, understanding where the domains of public health are, what are the employers of public health, really? Because once you know the domains and you know the employers, it's easy to know where to look for those jobs. If you don't know the domains of public health or you don't know where the employers are, it'll be very hard. And I think that's what a lot of people are finding very hard, where to get those jobs, where to look out for. A lot of times, a lot of people look towards the NHS. I know the NHS is the largest employer of labor in the United Kingdom, across board. Yes,
Yeah.
it is. It's a fantastic place to be. But public health does not start and end in the NHS. Local authorities are like, if you're from Nigeria, like I am, in Nigeria, we have the federal, we have that federal style of leadership of governance. So we have the federal government, state government, and local government. Now in the UK, we have the national government, the central government, and the local authorities. It's equivalent to I would say it's equivalent to our states. That's what I'm going to put it at. Yeah, really. So you need to know that the local authorities in the UK, especially where we live, the local councils where we live in, employ public health professionals. So knowing that also puts us in a very good place to know, okay, there are rules for me as a public health professional in the local authority. Now we've talked about local authority, talk about NHS. Private institutions like foundations, NGOs are also very good employers of public health professionals. Then health-focused charities, we call them the VCSC sector, really also employ public health professionals, but the capacity might be different because they are on the receiving end of the commissioning. So there's something we call commission. So I will just backtrack a little bit. There's a skill called commissioning, and I've seen a question already. Someone asked, "What about
Yeah.
commissioning skills?" Really. So why I'm not going to put that as top priority for public health, especially for entry roles, is that if you have not worked in the local authority, especially, the chances of you having that exposure, having that skill is nil, because commissioning means you are delegating something that you're supposed to do, that you have the legal backing to do. You're delegating it for somebody to do it on your behalf. So that's where I said that's where most health focused, NGOs and charities come into play, because they do a lot of that on behalf of the local authorities or even the NHS or the ICB, because those are commissioners. The local authority is a commissioner. The ICB, NHS ICB is a commissioner. So usually those charities that do the work on behalf of the local authorities or for the commissioners are a very good place to be to do public health, because you're doing it on behalf of the local authority. Then the national bodies like I said, the UKHSA, the OID are places, where you can also. So those are the different employers of labor in public health in the United Kingdom. So having that idea of the domains and the employers gives you a direction of where to look out to or where to look out for those jobs. So you should be on local authority job boards, have or NHS job boards with regards to public health, so that you're notified when jobs come out regularly. And the thing is, there's a huge turnover of jobs. And maybe because I'm in public health, I see it regularly. I can point that quite a lot. There's a huge turnover of those jobs. And but I understand the peculiarities of international graduates, with regards visa and all of that. That's a different conversation entirely. But those places, like I've mentioned before, the local authority, the NHS, ICB, the national bodies, health-focused charities, and national bodies, those are places where you can actually get public health roles.
Okay, that's fine. Thank you. So I know you've talked about, the impact or the importance of having a supporting statement, because from my own experience, when you're doing NHS applications, I think that's where the weight of the whole application falls on your supporting statement. How good is it? How robust it is. At the high level, can you just give us a high level overview of what we should tend to, add in our supporting statement to give us a chance? Even though I don't know how the local authorities work, but for the NHS, you have to write your supporting statement to fit the person specification criteria that has been sort of shortlisted or written on the job pack, addressing the whole essential desirable criteria across the 4 or 5 domains, like, qualification, experience, and all of those things. So your insight would be helpful.
It's the same thing with the local authority. It's the same thing if you look through the NHS, and that's because recruitment in public health, regardless of whether you're in the local authority, in the NHS ICB, or you're in the national body, it's very standardized. So it has to go through the same essential desirable criteria. It always has that. And what informs the essential desirable criteria is the level at which you're going into. So if you're going for an entry level, there's what is expected. If you're going for a mid-level, what's expected. If you're going for a senior level, there's something that's expected also. If you're going for a consultant, and director, there's what is expected for each of those levels of public health. Now, and a lot of us, where we're coming from, the countries where we're coming from, there's always an emphasis on your CV. That's where we come from. We know that your CV has to have everything with regards to your educational pursuit, your your experiences and all of that. But in the UK, it's different. The emphasis is really on your supporting statement. That is exactly what recruiters would read through to see if you have enough evidence for all of those criteria. So I tell people, pay attention to your supporting statement the most, because that is it. And what happens is a lot of us, when we see the essential criteria or the desirable criteria, we're not explicit. And you have to be I know, and I'm going to put this caveat, I know that usually for supporting statement, there's always a word limit. So maybe you have 5,000 words, or hardly 5,000, maybe 1,500, 2,000
Yeah,
words.
1,005, yeah.
Yeah, 1,005, 2,000, never above that. Hardly you see, any supporting statement that will let you to write 5,000 when it's not a dissertation. So, so there's the art, there's a way to write it. And what do I mean by that? To write a supporting statements for public health, you need to evidence examples. So if they tell you the essential criteria is having a master's degree, and you have a master's degree, so you write it, I have a master's degree in public health from the University of York, that's it. So practically, so maybe I'll make this quite practical. Whenever you're writing your supporting statement, you see a list of essential and desirable criteria, or criteria to write from. I would say before you write it in a prose format, answer each of those criteria in one line each. And what should each line be? Each line should be, do you have a master's? I have a master's in public health from the University of, that's what it is. That's how it is. If they ask you, do you have skills, maybe time management skills? I have showcased time management in my role as, so you must also give examples. It must be as explicit as it can be. So write it each one line each for all of those things. Then at the end, when you've written everything, you can then now combine them into paragraphs, into sections, so that it's readable. But once you've done it that way, what it does for you is that you are sure that you have been able to evidence things on each of those criteria one by one. Because if you start off by writing it as a prose, the temptation is that you would not be able to write enough for each of those criteria. So if you take each criteria one by one, write it in the affirmative. Yes, I have this criteria. I have this qualification. If I have this skill, yes, I have the skills as shown in when I worked in so, I was able to show each example. And the best format, I know a lot of times, a lot of people say you only use the star format in interviews. I would say that's wrong. You also use the star approach in your supporting statement. What you might just have to do is that you might make it an abridged version. What do I mean by the star? The star is the situation, task, action, and result. We use it in interviews. If they ask you a question, you want to respond, show what situation it was, what task did you have to do, what actions, and what was the result. Same thing in your supporting statement. When you write a supporting statement, you write it that way for each of the criteria. So at the end, when you're done, you now combine all of them together in sections, in a prose format, in a readable format, really. And one thing that helps if you have the allowance of it in words, one thing I would say is put your supporting statements in headings. So I would say skills, knowledge, and qualification ones, experience one. You need to just put it so that it's readable, because public health especially, maybe some other people, I know some other industries will say they do a lot of, the AI does a lot of screening. But I will tell you for a fact, in public health, the bulk of it is still read by people, by consultants, senior practitioners, really read through, a lot of the applications, the supporting statements. So it's a thing there's a checklist usually. If I'm going through different applications, I look at it as this person's, evidence the fact that he or she has that qualification or that criteria? Is there any evidence? Is there any further evidence that so it's a tick box, it's like a checkbox, checklist.
Yeah.
So if you don't have that, or if it's difficult to read through and understand how you've written it, it'll be very hard for me to look through and be able to show that you have really evidenced it. So that's how to write a supporting statement. I don't know if this is quite explanatory, but I've tried my very best to explain that way so that you can really look at what you've done before and see how to make it better, so your subsequent future supporting statement will be better. So that's it, really.
Right. Thanks for
Then
that.
and just before I go, I just want to say something. Also, the choice of words you use in your supporting statement matters a lot. I know a lot of us we are huge team players and we don't like to take credit for what we've done, especially where we come from, especially if we're coming from Africa. We just want to be humble. I tell people you cannot afford to be humble in your supporting statements or in any interviews. You don't want to be humble. And I'm saying it in a very good light. I'm not trying to, pride is not good. It's not good to be proud, but in your supporting statements and in your interviews, you cannot afford to reduce yourself. So if you've worked in a place and you led a team, you must boldly, because most of the time the criteria are quite very explicit. Have you led? It's not a thing of have you supported with. So you need to be very clear. I led a team of 50 people. You must be very clear about that. So using adjectives like strategic planning, I've been involved in strategic planning. I've, partnership working, collaboration, health inequalities, asset-based community development, monitoring and evaluation, budget management, population health, community engagement, and co-production. Those are words that I call them the buzzwords in public health, but those words, when intelligently sprinkled in your supporting statement, it gives your supporting statement that edge because you want to show that you have the capacity for that, or you want to show especially that you have the experience and the competencies for that. So you need to use very active words, not passive. You don't want to afford I was in a team. If you were in a team, what were you doing in that team? You could as well be sleeping in the team. You need to show I led that team. I managed, I supported. You need to use those adjectives gives your supporting statements the push and the flavor that's necessary, really. So I wanted to add that in before I forgot. Yeah, thank you.
Yeah, thanks for, highlighting this last point. It's very key. So because a lot of people tend to downplay their achievements or their roles within whatever team they find themselves. Because you start saying things like we did,
No,
we did, and I'm like,
no.
no, the
You are
job is
not
not about we.
it's only you applying.
About
It's not
you.
we.
It's you they are looking for, not we. And when
Yeah,
you keep using we, even if led the team, recruiter is just checking what is this guy is writing. So that's basically maybe he didn't even do anything on that team.
exactly.
That's what they are hearing when we hear we. Then because I think a lot of people also sort of get confused when they say evidence of teamwork and they keep using we, forgetting that the role is about them anyway.
Yeah.
So that's fine. So let's look at networking. Now, a lot of people we talk about LinkedIn, having a LinkedIn profile these days. So how important is networking, within this whole job search strategy?
It's very important. And I think one of the issues I've had, especially with networking, or I've seen people network wrongly, and in a way that I feel most of the time we don't take cognizance of what we have within our very local sphere, our circle. We're always looking for things way beyond our reach or way out of our reach. And that's what really causes that anxiety. First things first, networking means your classmates, your colleagues are first your network. And I know we don't see it that way really because we think, we're just colleagues, we're just classmates, we're just course-mates, we're just MPH colleagues. Never say never. And one experience that really, that got me when I came to this country. I remember I did my master's at the University of York. So yeah, I came in through my master's to do my master's, alongside with it was just a lot of journey, but I did my master's at the University of York. And I remember that we were about, say, if I can remember clearly, maybe about 200, more than 200, about 200, people, um, we did quite well to just mix with each other and all of that. But I had mentors that I could speak to. So one of the things they always told me, oh, start applying early, start applying early for jobs and all. So I started applying, getting a lot of opportunities. I got some interviews. And I remember there was an interview I went for in a local authority, and somebody on the panel was my classmate.
Oh,
Interestingly, yeah, he is a manager, a public health manager, but he came to do a top-up course in Masters in Public Health, and he was a part-time student. So we hardly even saw, we hardly ever have had any interaction in class. Maybe very few, maybe one, I can say maybe once, maybe because we had these small groups occasionally. But I was stunned that day to see the person across across the panel is my classmate or was my classmate in the masters, and that spoke volumes for me. It made me understand that you need to recognize that your classmates are your first network, because people come into to the masters for different reasons. Some people might never work in the United Kingdom, but you might find out that they maybe in next couple of years they're already top shots in an international NGO, or they're top shots in the World Health Organizations. You never can tell. So I tell people, put that first impression, do well to network with your classmates, reach out to people, even while you're doing your master. Then some of us here might have finished our masters already, and it's not like we can go back, but be deliberate about it. If you have to go now look for people that are your classmates on LinkedIn, that's how you build, connections first. I know a lot of us, we want to shoot and look for who the director of public health is and start, connecting with them, who the regional, that's what we hope to start doing, on LinkedIn. That's what I see a lot of people do, which is good. It's good because, eventually, that's what it is. But the first thing is recognizing that your classmates is your top, network. And with that, it's easy to connect, to see what people are doing. What some people will just, do for you is to remember your name. Because I remember this lady who was very smart, who always talked in class. It's really not about what better you came out with a distinction or merit. It really, as long as you go through the process of a master's, it takes you through the process and you understand the evidence, you understand things that you will not have, realize if you didn't go through that. So that's what it is. The experience is what really matters. And if you put a good image of yourself out to your classmates, people will remember you. That's what it is. So I think the first thing is to, network with your classmate. Then you can now actively seek out for mentors anywhere. It can be your faculty, your lecturers, because a lot of times our lecturers, especially in the UK, they are not only lecturing in the university, they're doing so many things. They have so many projects. I remember one of my lecturers, because I remember, so one of the things, another story, when I came into to do my master's, the first class I had with one of my professors, I knew that I was going to do, a topic for, I was going to do something with regards to our area of work for my dissertation. And I immediately after the class, I reached out to, I sent an email. I loved your class. I enjoyed your class. I asked a couple of questions. Some of my questions were very stupid, but they will never, they will never tell you that your questions are stupid. But she was really she noticed me in class. And I did that just so that when I send an email, she can remember, oh, there was this black boy in class who asked this, ridiculous question. So and I told her, I said, I really would want to do my dissertation with her, and she said, no problem. That was barely 2 months of starting my master's. So I knew that from very on, because I knew that if you engage with your lecturers, especially because they're into a lot of things, she's doing a lot of work across Nigeria, West Africa, Asia, and all of that. So you need to be very strategic with your classmates, with your faculty. Then you can now start reaching out to people on LinkedIn that are strangers. That way, I know a lot of people tell you, I've read something where someone will say, comment on people's posts,
yeah.
on LinkedIn. which is good. I'm not here to say that's wrong or not, but I say if you're going to comment, make sure you're adding value. Don't necessarily just comment sporadically. Because when people say comment on LinkedIn, you definitely will not leave on LinkedIn. You
Yeah.
would not. It's a place to jet in and jet out. Engage. You're supposed to engage strategically. With people. What are people doing in your space? What are people doing in your area? What are things in your interest that are being done that you can really contribute intelligently to? So once you do that on a regular basis, people get to understand, oh, so I know this person always comments intelligently on my post. It's not just a, just a random thing. So those are the things I would say. Then if you're on, now I'm going to put this caveat out. It's just me, with regards, I know a lot of people, we do a lot with regard, we want to create a brand. And I always will say, create a brand on the right foundation. Be doing something to create a brand. Don't be a person that is talking regularly without doing something. Because on public health, we have a lot of talkers. We talk a lot, and that's the thing. We talk a lot, but you need to show that you've done something. You need to actively be involved in something. You know, because and it's not a thing of or the scale of what you're doing. It's not a thing of it's a big thing. As long as you're engaged in something public health, from that you can scale up, and um you can showcase compete. You can showcase the word is failing me really, but whatever you're doing in your space, however big, small it is, you can scale it up and you become an authority in it. So don't be so brand focused. You want to create a brand, a public health brand for yourself without having anything underneath as a foundation for you. That's where you have a talking point. You can always relate, engage people, and people can say, "Oh, this person does this," and it's a talking point for both of you, really. So that's my advice with networking. Just network strategically, really.
Yeah. Thanks. So one thing I probably want to add in terms of this whole networking on LinkedIn is also if you think you're going to be active on LinkedIn, I think it makes a lot of sense to sit down and sort of optimize your profile. So, because what typically happens if somebody comments on somebody's posts, what you guys don't know that happens, or you might know, is I look at the comment section and I click on the person who's commented and I want to know a bit more about this person. And when I land on their profile, it's bland. There's nothing there. I can't even make sense of who this person is or what they are doing and all of that. And I'm like, okay, no problem. I just move on. So again, you need to, like you said, find something exciting or something doing to say, once I come, I'm like, oh, okay, this is what this person is doing, or this is what this person has done and currently doing. So you just need to make yourself really interesting for people to want to engage with you. Because whether I like it or not, they check first before they decide if they're going to reply this person or not. So it's what it is, really.
Yeah.
Then looking at the whole, yes, we've talked about, where to find these jobs, how to, do your applications with focus on, supporting statements and all of that. So realistically, looking at your own journey, right?
Yeah.
So how long did it take you to, get your first role? What challenges did you sort of face after, graduation, trying to find your first role, and
Yeah.
how did you overcome those challenges?
Yeah. Okay, so caveat here. I like giving caveat. And the reason why I give caveat is I understand that we are humans and our journeys are different. So I never want to make my journey a rule or the prototype
Yeah.
because it's different. How I move, I will tell my story of how I went through it, just to encourage you. But it might, but it will never be the same. Because we're all very different with our different priorities, different journeys. So that's the caveat I want to give. So I got my first job in public health before I finished my master's in public health, which is when I tell people, people are like, oh, that's very strange because it takes a lot. Like I said, I had mentors early. And because I had mentors early, I started applying very early. So I got my right amount of the right dose of unfortunately very early. I got tons of unfortunately, and because I got those unfortunately early, it made me build, and say capacity for it. So it came in. So me getting the unfortunately were not when maybe of course, I'm human. At the very initial stage, it was very, it was jarring. It was painful, especially when you think, oh, I know I'm competent. I know I'm qualified for this role, but I still like to get it. And maybe that's the right of way to getting the jobs in the UK, because I think a lot of people say that too. And for me, that built capacity for me. And because of that, I could, getting opportunities did not phase me any longer. So I was audacious in it. I kept doing it. So before I finished my master's, I got a job. So within, finished my master's, got my results, and the next month I started working in the local authority. So that's how the journey was for me to get in my first role, really. And from there, within 3 years, I got in a senior role in public health. And one of the things that really helped me, I said this in a previous, podcast with Ron, is I was blessed with a very secure and supportive public health manager. My line manager was very supportive. I think that's when you have a very secured person. She was very secured and she could recognize my skill, my competence, and say, oh, how do we leverage what you've done already from Nigeria? How do we ensure that you can move up, and move up fast? So that's one of the blessings I had too that really helped me, move on to my role. So that's really in itself, that's why I'm just going to say, in a very nutshell. I don't know if there'll be more questions with regards that can expatiate a little more, but starting early, starting the applications very early helped out, getting the first role. Then in my first role, having a supportive manager that saw, my skills and what I could do, my talents, and really encouraged me, gave me the capacity to expand all the things I needed to learn and do to get the senior role. So that's how the journey has been, really. And all of this happened within 3 years, really.
Thanks for that. I probably think more questions will come when we hit the Q&A session. So another thing I probably want to chip in is for people, I don't know if anybody is currently doing an MPH or whatever. So even though I didn't do MPH, but one thing I find that worked was you have to just be very deliberate and strategic about how you're navigating this thing. So like myself, I also got my first role before I even finished, school. So I already had the job waiting. So immediately I handed in my dissertation, I just moved into my role. And what sort of helped me was I started early. By the time we had finished all the modules and we started doing the dissertation work, that's when I started doing the applications, started getting all the unfortunatelies, then started understanding the landscape. Okay, this is what working, this is not what's not working. Having those conversations with recruiting managers, oh, people rejected me. Okay, can you tell me why you rejected me so that I can get better in my next application. So all of these things take time. So you don't want to be at the pressure point when you've done everything and everything is just happening at the same time. So just so that you can pace yourself, you just need to sort of start very early. Then looking at transitions, I think somebody has mentioned this, but we'll probably just touch this a bit. So I think this is specifically for clinicians or professionals who are trying to move into public health now.
Yeah.
So what steps should they even take to get into the public health space?
Yeah. So, because I'm also a clinician, I'm a medical doctor from Nigeria, and that was one of the things that I had stacked, against me at the very initial stage was, yes, everyone can recognize the fact that you have a length and breadth of clinical skills, which are very transferable, maybe apart from diagnosis and in giving medications. Every other skill in in clinical medicine can be transferred into public health. But the one thing that kept on, that was a recurring, theme whenever I applied and I got, unfortunately, was the fact that I didn't have a UK experience, So I would say, especially for clinicians coming to the UK, I want to go from clinical to public health. I'm very sure that as a clinician, and when I'm talking about clinician, I'm not talking about only doctors, I'm talking about nurses, pharmacists, anybody that had worked in the clinic, in the hospital, they are clinicians, really. That's the broad term for all of us. I'm sure that at some point of our training, maybe med school, dental school, physiotherapy school, medical lab school, any school we've been, nursing school, we've done some level of public health. I'm sure at some point when we started working, whether you worked in, the government space or you worked in private, you've done some level of public health. So now that you've had all of those skills, no, it's undeniable. Even in the UK, they will not deny those skills because it's things that can be transferred. What the only emphasis will always be, and that's what was for me, was you don't have the UK experience. So how do you get the UK experience? That's always the question. So I always will tell people, you need to place emphasis, especially if you're doing a master's. I know recently quite a number of universities have started doing masters in public health with placements, which is fantastic. Because if you see any masters that has a placement, I'll tell you, go for that. Because what it does for you is that it gives you that industry experience and exposure. Because you can categorically say, I had 6 months of work experience, and that was covered during your master's period. That is brilliant. But for some other people, like myself, my university didn't have that. So I needed to have that. So you need to place a lot of emphasis on work experience, work placement, volunteer, especially in any of those employers. So like I said before, recognizing those employers like the NHS, ICBs, the local authorities, the health-focused charities, the national bodies, and private institutions of private NGOs, foundations. Once you can have an idea of all these employers, you can then now actively start seeking out work placement with them. What I did, and I would really advise everybody, is from early on, once you start, getting, even before you start getting the opportunities, apologies, start shooting your shots. That's what they call it in Nigeria. Start sending those cold emails. And I did that and it worked for me. It worked brilliantly for me. So if I backtrack a little bit, while I was in school, the master's is full time, but you hardly would do anything more than 3 days a week. Hardly. And even if you're doing anything 3 days, it's going to be maybe 2 hours in the morning, 2 hours. It's not as intensive as maybe you do 8 to 5. It's not like that. You have time. If you plan enough. I know a lot of us want to work, do some other this, but if you know the long-term goal is to get into public health space, then you prioritize having an unpaid. So this work experience, especially in the UK, is better if it's unpaid. If it's paid, that's brilliant. That's good. That's good. But usually, if it's unpaid, a lot of people would be more responsive to you when you tell them, I want to do an unpaid, that's what it is. Everyone likes cheap labor, or everyone likes, when you're not, you're not taking out of their budgets. That's the truth in the UK. So I'll tell you, I did a lot of that. I started sending, cold emails very early, even before. So I looked around. So I strategically looked on LinkedIn because even before I came to the country, I didn't have a LinkedIn, or besides, I was not very interested in LinkedIn. But then when I came to the country and I spoke to my mentor, like, you need to have a LinkedIn. So that was one of the reasons I created my LinkedIn. Like, okay, I need to start looking out for people. Who am I looking out for? I'm looking out for the authorities in the local authorities. I'm looking out for authorities in the local councils, like people in public health. So I look for the director of public health, look for consultants in public health, look for public health managers, look for them on LinkedIn, look for their emails on Google, just to have that. And I started sending out emails, cold emails to them, like, oh, I'm currently a master student. I've had experience with public health, but I want to understand what the public health space is in the UK. How can I contribute? I've learned so much in the theory in the class, but I want to be able to apply it practically in the industry, and I'm looking at coming over, to do a placement, an unpaid volunteer work placement with your team. I sent it to quite a lot of organizations. I think I got only 2 responses that were positive, and one of them agreed for me to come over. And in fact, I didn't even have to go physically. I did everything online. Yeah. So what I did a lot of one-on-ones, did a lot of sitting in meetings, understanding the language of public health, because it's very important once you now I understand why there was so much emphasis on having a UK experience, because even if you have all the experiences outside the country, the UK's public health space and the environment is very different. It's very different. So you need to understand the language of public health in the UK, and you can only have that language if you've worked or if you've seen it being done. So prioritize having that exposure, in public health. Once you have that, it was easy for me. Once I had that, it was very easy for me when I had my next interview. And interestingly, where I got my first job was the next interview I got after my, after my placement. So it was easy for me to evidence. So they could see somebody eager. Yes, I didn't have all of the competencies complete, especially things that are very specialized, like commissioning and procurement, policy formulation. I'd not done any of those before I got my first job. But because I'd gone through that same process of working, of having a work experience in the local authority, it was easy for me to say I'd sat in this meeting, and because you're a smart person, you go online, you could see how things are being done. So when I had one-on-ones with people and said, oh, they tell me they've done a service review, I go online and say, well, how do you do a service review? If I say, oh, we've done a needs assessment, I check, how do you do a needs, why are you doing a needs assessment? Asking questions. So when I'm talking to people, like when I was in an interview, it was easy for me to say, I had an engagement, I spoke with, I was in the room where, I supported with things like that. Was easy for me to evidence. And they could say, okay, yes, you don't have all of the skills, but you seem like someone that is very interested in public health here. And you've had some level of skills from Nigeria where you're coming from. So it was easy for them to take a chance on you. So with that, it's easy to break that ice at the very initial stage. So I would tell people, if you want to, have that experience. In fact, and this doesn't only even apply public health. I remember I have a friend, my very good friend, is a lawyer from Nigeria, and that's one of the things that he also did. I know, go volunteer somewhere, just have that, because once you have that volunteer experience, in this UK, it's easy for you to shape your responses in your supporting statement to suit the competencies, the skills, and the knowledge that's been asked for. But once you don't have that UK experience, a lot of recruiters are a little very, even if you have it, except if you're coming in from maybe an international NGO, and that's because it's just an international NGO.
Yeah.
They would relax because of that. So if you're coming from the WHO, they would, because they know that you've taken that skill is very transferable and you don't need to do too much. But if you're coming from a place like Nigeria, Africa, you need to understand the language here. So that's why I would say put an emphasis on work experience, volunteer, unpaid one. If you get, that's good too. It'll really do you well.
All right, thanks for that. Let's look at some of the questions in the chat section. I still have one more question. I'll probably leave that. Does anybody have any question to ask? Please just indicate by show of hands, then you can just go ahead one after the other. So while I wait for people to raise their hands, I'll just okay, Levi, just go ahead. Can unmute and speak.
Okay, thank you very much. My name is Levi Ibiowo. I hope I'm audible. And I'm a final year. Okay, thank you. I'm a final year MBA student here in Nigeria, and I must say that this is the closest I've gotten to the public health space, even though I've been on LinkedIn for quite some years now, and I've been searching to see just who is out there doing what I'm doing. Okay, so I would like to, before starting my question, thank the organizers as well, the speakers so much, because even though I joined in late, the point at which I've heard to, it was like it has answered a lot of my questions. But then I just want to ask the speaker, what advice does he have for an undergrad currently in an MBBS program that wants to transition into public health space? Because in as much as we talk about public health over here like that, I mean, in my institution where I train, we don't really get mentors who are over there that went over to the UK or even around us that are majors in public health. Literally everyone are clinicians, and even the ones that go to the UK and the US are going to the clinical space. So asking questions and just locating the right person to ask questions become like it's like a meet. So even those persons over there as clinicians, it's as if their experience is quite different. They can't really give you the right answers. So I've been actually looking for this kind of space so I can ask this question. I mean, what is the opportunity out there? Because I just know that the clinic is just not my thing. So I'd love the public health space, and I need to venture in, but I need to ask the right questions and probably get the right answers as well. Thank you so much, at least.
Yeah, thank you very much, Levi. So what opportunities are out there? There are quite a lot of opportunities now, but the opportunities are not isolated in itself, and that's what it is, honestly, and that's the truth. Maybe if you didn't have, if if there wasn't a thing of visas, stay in the UK and all of that, maybe it's much more easier. But that barrier on its own, of visas, sponsorship, staying back in the country, it puts a different, it's a main player in the opportunity. So even if the opportunities are there, you're limited by, your status as an immigrant, and that's the honest truth. So while I would say there are quite a lot of opportunities, I see them on a regular basis. And I tell people like, I wish a lot of people can see this, can get this, but there's always a caveat of the visa restrictions. And that plays out. I know it's not only in public health, it plays out in all the different sectors in the UK with regards, they need a lot of talent. They recognize the talent, but they are incapacitated by that, that bottleneck. So answering your questions, there are a lot of opportunities. I'm sure Dr. Ron could tell you there are quite a lot of it. But that bottleneck of visa, sponsorship, legal status and not is what changes the entire dynamics of everything. So I know this is not the kind of response somebody you would like to get, but I'm just being very real, And especially now that the immigration rules is stating that before any company, sponsors anybody from outside the country, they have to show beyond a reasonable doubt that they've not found anybody in the country to do that. And that's a big ask by the government. And they know why they've done that. So, but because, as smart people as we are, we would always find legal way to maneuver ourselves, like emphasis on legal ways, that's how much I can say here, really, but there are opportunities, yeah.
Okay, sir. I just, as a follow-up, I would like to ask, thank you so much, though. What is your advice for me or for someone like me as an undergrad that wants to graduate? Do you think there are some, let's say, soft hard skills, although I've heard a lot of it, that I should get that would make me stand a competitive candidate over there and all? So what advice do you think I should, what advice do you have for me as an undergrad with such a passion?
Yeah, so there's no knowledge, there's no skill, there's no competency that way. So wherever you are, make good use of where you are, really. I've seen it, a couple of times that it's the person that knows how to talk, quote and unquote, or can show themselves doing the work that really gets the fruits and the reward, really. So as much as you're doing, know how to position yourself for where you need to get to, especially with regards to the United Kingdom. Where you are, look for opportunities. If you know you want to really pivot into public health, start working in that space. That there are NGOs, there are quite a lot of NGOs in Nigeria. And I think Nigeria is just a very right place for public health to thrive because there are quite a lot of public health issues. So I can't really tell you that, there's specific skills that you must, because what that does, is that it makes you start to narrow your view. What it does is that you start only looking at that. You will not, and to be honest with you, you must be very flexible. You must your eyesight must see far and wide. You must not don't have any tunnel vision yet. Be very receptive to anything that comes your way with regards to public health, because what it does is that once you gain the competencies of one place, you can, take it over to another place, to another thing, to another area, to another focus area in public health. So don't be too, because I'm tempted right now to tell you, oh, there's some skills that if you go learn it now, you will get. It might not. I remember one of my very good friends is a pharmacist from Nigeria. He had done quite a lot of things with regards data, So when he was coming to the United Kingdom to do a master, we met in the masters, and when he came over to do his masters in the UK, when he was choosing his courses, it was geared towards data. Because you have the luxury to choose some of your courses in master's program. So he did a lot of regression analysis, a lot of data. It was quite a lot of it, and I really didn't understand it because I just did the very basic data. I did a lot of policies, health behavior, global public health, very public policy, because I knew that was what I wanted to do eventually. But for him, he did a lot of that. And I asked him, one day we got talking, and I asked him, he said, oh, I want to go into that public health data analysis, data scientist, sphere. And I'm like, wow, that's very smart, because from Nigeria, I'd done quite a lot of it. So he came here, did all those courses, and today he works as a public health data scientist with the NHS. Yeah. So you just have to be very receptive and very smart. Don't be too closed up. Everything you've gone through, every experience you've gone through, everything you've done in Nigeria adds up eventually. Like I said, the issue of the visa and all of that causes it changes the dynamics of this conversation. But I will always say, you never can tell. You need to be positioned right for the next opportunity that will come your way. So that's the advice I hope I've answered your question enough. I really hope so. I really hope so.
All right, thanks for that. I can't pronounce his name. Kide or Kide. I hope I'm not destroying your name. You can go ahead and ask your question. If you're there, you can unmute your mic and speak if you're there.
Sorry, I was trying to unmute my mic.
All right, that's fine.
Yes, can everyone hear me? Sorry.
Absolutely,
yes.
Yep.
Yeah, thank you for this session. I find it very useful. So, my name is Kede, and my journey in public health started off with a master's degree in Oxford Brookes Uni, and I am currently working in a local authority. I use the public health graduate trainee route, and this position is, geared towards gaining your competency across the various domains of public health, evidencing the 34 standards of public health, and then at the end point is getting like a registration in the public health register.
Yeah.
Here in the UK. So my contract comes to an end next year, sometime next year, June, and I've already started, putting out applications already. And I like your tip about starting early, because I think it's very good to start early. So you start getting your opportunity early, and then identifying gaps, areas where you can make amendments. So
yes,
my question is, what's your take on, where you have like a note saying if you would like an informal conversation with your employer, kindly contact the email or a number. So what are we supposed to be discussing with that person? I mean, that informal conversation, other than what is actually in the job spec. So I would like to know, because I'm not always clear. Sometimes I would like to reach out, but just so that they can know you a bit outside your personal statement. But I'm just confused as to what to say when I make that call or send that email.
Yeah.
Thank you.
That's a very, very good question, because I was somewhere, one of my friends had a public health catch up like this, something like this, but physically in Manchester at Daisy. She works with the United Kingdom, HSA, and this question came up. And to be honest with you, I know a lot of people use this as a strategy so that whoever is recruiting, knows your face. Which, when I heard it, because to be honest with you, I can't count how many applications I've done. I've never called or sent an email to those numbers. They say, if you want an info match, I've never done that. But it was at that meeting, I heard, somebody was saying, "Oh, we do it," and when they talk about the rationale behind reaching out to you, so that they get to know you, and I'm like, that's a very smart thing. But most of the time, most of us forget is that the only thing that gets to your to the recruiters, or better still, so when we apply, like the local authority, once you apply on the portal, all your details cannot go to the recruiters. Don't make me recruit them, the team that's recruiting, because that is your data, your very sensitive data, like I'm sure all of us know about the Equality Act. So there's some protected characteristics that we all will do. They cannot have those data. Your recruiter, the team recruiting cannot have those data. HR would never release the data to them. So the only thing that goes to them is your CV and your, what do you call it? Your supporting statement without your name, without any identifier. So they don't know if it's a man that's talking. They don't know if it's a woman that's talking. They don't know if it's a non-binary person talking. They just see the CV, and the CV that just has all the different maybe experience, education, very, very sparse like that. But it's mostly the supporting statement that goes to the team recruiting. So they don't have, and I'm sure you've seen that even in the supporting, they'll tell you don't put any identifier in the supporting statement because they want it to be as objective as it can be. So why a lot of people, do a lot of talking with the people informally, the rationale is smart, but I don't know if that works, because sometimes I just look at what exactly do I want to tell them that they will not eventually find out in the supporting statement. So I would advise that you don't put a lot of pressure on yourself to always want to talk. Yeah, I know people do it. Some people said it's worked for them. Oh, well and good. But even if it's worked for them, from the standpoint of the recruiter, they will never agree, or they will never hold up to that they've recruited you because you've spoken with them, because that defeats the entire process of it being very objective and being very fair. So you can only, if you've done it before and you get a role and you say, oh, I've done it, but from the recruiter said they will never agree that they've done that to favor you above every other person. Yeah. So I'm a little very, I'm very political with this answer, but that's the honest truth. So I would say don't put a lot of pressure on yourself to want to speak with them, but I would say as long as you can write, I think, and that's why most of the times, I remember my first month in my master's, I didn't do too well I finished with a distinction in master's, but I remember my first month model. It wasn't good enough in my own standard, because we don't know how to write. Where we're coming from, a lot of us don't know how to write. So I think once you learn how to write and to show evidence, your skills, your knowledge and competencies, you'll be very confident that your supporting statement has gone way ahead of you, and you're fine. You're okay with whatever result comes out of it because you've done your very best. So I think that's what we should really be very focused on, ensuring that we write and appealing and inviting a very, very attractive supporting statement, really, because that's what they use to recruit, not necessarily you speaking to them ahead of time. I don't know if Dr. Ron has any.
Yeah, I'll probably chip in, though I have a slightly different perspective,
Okay.
towards, So typically I would say, yes, please, if they say reach out to so person, please send them an email to say, yes, I want to have a conversation with you. So for me, personally, this is my own view anyway. So whoever you're having that conversation with, most times tends to either be your direct line manager or probably one step ahead of your line manager. So for me, it's a good opportunity of getting a better insight into that role about, okay, I'm in the digital space anyway, so I'm just speaking from a digital perspective. Okay, you guys are trying to implement this new software or it's already live, you're using it. I'm trying to understand, okay, what are the challenges you guys are facing at the moment? Because the truth is, once you start that role, and whoever that is there that is your line manager, there are things they probably want you to start solving for them or hit the ground running. So for me, it's a good avenue of understanding what's happening, where they are now, and what things they probably might want to be placing more emphasis on. So, and those things I tend to sort of put them in my own application. So, if, for example, now I hear during the conversation to say, okay, we're trying to put this new system in place, and maybe in my previous role is something I've done before, I'll probably be using that as an example when I'm trying to evidence the skills or questions that I say, tell me a time when you've maybe implemented the system. I'll probably lean towards, okay, I've actually done this in a previous organization. I'll use that example to say, okay, I've actually sort of done this. Then if it's a new team or a new project, you want to understand why have they set up this new department and all of that. So it just gives you I feel better rounded view about what you're getting into and sort of also helps me prep better because me, I like planning. So I'm like, okay, if they now shortlist me for an interview, what are the likely things I might anticipate based on this conversation? So I like being that very prepared, so that's the way I see it. So you don't lose anything from having those informal, conversations or understanding what the team culture or what's happening generally. So I feel more confident when I've had those conversations than waiting for, do your supporting statement, do your application. They now shortlist you before you now start prepping for the interview. Once they shortlist you, you've lost the opportunity of having that conversation to actually understand what's happening within the organization or the department where, you're going to work. So that's the way I see it really. Again, like you said, it's not from the point of maybe you're trying to show face or because it's just your SOP that gets to them. That's the only thing they read and they decide, okay, we want this person or we don't want, that person,
Yeah.
if
Yeah.
that makes sense. Let me see. Okay, I think there was a chat somewhere. Hold on. Somebody said, I think Joe said, what specific IT skills? Okay, Onova, I'll come to you after this question. What specific IT skills are required to practice public health in the UK? Specific IT skills. Interesting.
I think it's just the basic IT. You should know how to use Microsoft Word, um, use Excel, use PowerPoint, because I think those are the things that you use on a regular basis for anything office, admin work. Really, I don't think there's any. Yes, maybe for if you're going into data, then you should know all them, the dashboards, what's this word?
SQL, Power BI.
SQL, Power BI, those are things, that you should know. But that's very specific for data analysis, data science in itself. But every other part of public health, really, once you can put on your system, you know, you know, maybe the only other thing is how to use Teams if you've not worked with Teams before, because I think most organizations use Teams. So use Teams, OneDrive, SharePoint. Really, those are things you learn. But as long as you're a smart person, so you would do anything Microsoft, you would be fine with it, really. I don't know if there's any other specific skills. I've been thinking about it really that I've been using. Like I can't remember, Excel, PowerPoint, really. Yeah,
Exactly.
maybe.
All those stuffs that sit within Microsoft, Excel,
Yeah,
PowerPoint, Outlook,
Outlook. Yeah,
sending emails. Basically, basic stuff really is enough to
yeah,
get you going,
yeah.
if that makes sense. Onova, go ahead.
Hi, good evening. Thank you so much for
Hello.
the opportunity. I think I've got two questions, but it can be
Okay.
put into one. I noticed recently that when you're applying for job, especially within NHS or NHS job, they do, at least some of them ask you, let us know if you use AI to complete your application. And that question always throws me off. I'm thinking, do I say yes? Do I say no? If I say yes, what are they going to think about me? Are they going to think that, oh, I can't write and therefore I use AI? Like I refuse to be confused, but I'm a bit unsure of what the right answer is because I don't want them to think less of me by reading and thinking that, oh, is all AI based, and therefore this particular person or candidate did not use, the faculty to write this particular statement. And then the next question is, some of the job description can be a little bit ambiguous. So it's really hard to actually understand what are the skills that I do use different tools to quite understand what are they requesting or requiring, or what is it that the job is. I don't know how to phrase that, but the phrasing within some of those job description, that's thrown me off a little bit. I feel like I've got the skills. Then at the same time, I'm thinking, I'm not sure if I actually have the skills. Am I answering this question right? What are the tools that is out there that can actually support in terms of breaking down some of those job specifications and then go for it without putting a limit to oneself? I hope I'm making some degree of
Yes, yes.
sense here.
No, you
Thank you.
perfectly.
Thank you.
Yeah. So I think the first question is, so the thing is, quite a number of people like a number of people, recruiters, especially in public health, when it's not maybe a large percentage of people read through the applications itself, and once you tick that box, even if you sparingly used AI, because you're not there to defend that, what it means to them is the bulk of your writing is AI. That's what it means. Once you tick that box, because you're not there to defend it. So what I tell people is, yes, there's a responsible and reasonable way to use AI to write, and it should be a thing of helping to put your words in a concise way. So the crux of you writing, it's your ideas, it's your layout, everything you want it to be. Yes, you can use the AI to make sure that it's brilliantly done in good word, your vocabulary used, the tenses used, and all of that. It's written in a very, interesting way. But the crux of you writing, so if I was the one, maybe Dr. Ron would have something different to that. But if I was the one writing, as long as the ideas from conceptualization is my writing, I would put a no there. And that's because I know if I put a yes there, it will mean to them that the bulk of what I've written is AI generated. So I need to just ensure, because I'm not there to defend that. But that's only if you've written from the bulk of you've written from your mind, from your head, you've written from your experiences, then the AI just helped you to do a lot of maybe grammatical errors and all of that, just to ensure it is very concise, which is okay, which is reasonable, So it's that on its own would not warrant me taking the box as a yes to AI use. Because if I do that, it sends a wrong signal to whoever is reading through. Dr. Ren, do you have a different thing to that?
Very tricky question,
Very tricky.
actually, right? So, but again, I've seen people who sort of use AI, end to end,
Yeah.
and so the problem is when you're reading this type of supporting statements, there's no personalization
No.
in those
You would
stuff.
know. You would know.
So it comes off as, I'm not sure this guy
Mechanical.
has actually done this thing, because so even if I tell people, yes, okay, maybe you could use AI or whatever, like you said, just maybe to structure it properly, but those answers within has to be your own experiences,
Yeah.
right? So I think I've had this conversation somewhere. Somebody said, yes, it's fine to tell them, okay, use it to fine tune Kini. So again, now when we say AI, things like Grammarly come into play.
Yeah.
And Grammarly is basically helping you to structure stuff, looking at your tenses and all of that. So there is no crime, even in the academic environment.
Yeah.
People use Grammarly to fine-tune their Kini and all of that. So it's just, for me, I could basically, yes, I use Grammarly to, finalize the structure, grammar check, and 1, 2, 3, 4, and that's it. But like you said, the bulk of the Kini or the information there, it's my idea, it's my concept, it's my experience. I just use this tool to fine-tune it, and which is absolutely fine, if that makes sense.
I totally agree with you. Yeah. Then the second question is, yes, sometimes, as standardized as the recruitment is for most places, it can be very ambiguous. So I would say there's no crime in finding out checking on Google, what does this really mean? Or checking, with AI, find out, can you break down the questions, the job description into, understandable bits. Now, you also have to bear in mind that the context of what that of the description of the job description is very important, because the context of I'm trying to look for something very relatable. But if it's not in public health, so whatever interpretation is going to give you must be in relation to public health, because if it's ambiguous, that means it can have different meanings outside of public health, and that's the problem. So whatever explanation you want for the job description should be in the context of public health, especially in the place where you want it. So because sometimes the context of partnership working in the NHS ICB is a little different from partnership and collaboration in the local authority. Yes, there's the general, partnership and collaboration, but really some very minute, very little changes. So you need to have an idea of where exactly am I applying to, so that can give me the context, to understand what the job description is, so that I can correctly, answer the question. But usually, very few times would it be ambiguous. I don't know, I can't really say how many you've done, but I would say most of the time, because it's quality, all this, even the essential criteria, whatever it's going at, it goes through a lot of checks to ensure that they are asking the right questions to fill in the role they want to fill in. So most often than not, the questions are quite very clear. Maybe you just don't understand it. So one of the things is find out, maybe speak with somebody, to understand it more. And maybe it can now be an avenue for you to have a discussion with the resource person in the, in before, the person you need to speak with that is recruiting, so that you can have an idea of what exactly do you mean by this. Those are questions you want to ask, and I think that's a very good time, and place to ask them. I don't know if I've answered the question, or if Dr. Ron has any addition to make. So
Yeah, I agree with you again. So that's one of the good examples of, why having those informal conversations actually matter. So you've seen a job ad, you've downloaded the job pack, you're reading through and are like, okay, I really don't understand what these guys mean by this. Does it mean this or does it mean that? So these are some of the questions you ask during those conversations. I remember one of the previous roles I had, I was looking at, I think, their digital strategy, then it was reflecting there. So I just penned that as a question during that informal conversation. When I was going through the job ad, though, this is what I saw. Can you throw more light on, So the guy was able to clearly explain, okay, then it made sense to me. So because then in my head, I had another example I was going to use to evidence that. But after that clarification, my mindset shifted. I had to look for something else to use to, evidence that. Then another way of tackling this is what I typically do. I just go on LinkedIn and type in the job title and I start looking for people who are in that role per se. So it's easy to find them and send them a DM that, please, see what I'm doing. Please, can you make out time, or what is it you do in your day-to-day role?
Yeah.
That matches, this is what I'm looking, at. Then they can offer more clarity to say, okay, this is what it actually means, or in my day-to-day role, this is how we navigate issues like that. So I think that sort of gives you an idea of what they're actually looking out for.
Yeah.
I hope that sort of answers your question, Novo.
Yeah, thank you very much. Appreciate that. Thank you.
You're welcome. So there's a question I think they asked about commissioning. I think you mentioned you've already spoken a bit about that before. Then Martin's saying best platforms to gain data analytics skill in relation to public health, paid or unpaid for a final year medical student. Then are there opportunities to combine clinical skills with public health competencies in the UK, and how do we access them? And also from your personal perspective as an IMG transition to non-clinical role, how fulfilling has it been being a public health practitioner?
Yeah, I'll start for the third question. So, how fulfilling has it been? Very fulfilling. Very fulfilling. Very fulfilling. very, very fulfilling. I have my work-life balance perfectly. So 9 to 5, my weekends are mine, my holidays are mine, no night shifts. It's an hybrid role. Most of public health roles are hybrid roles. So I don't have to go into the work every day, maybe just once or twice in a week maximum. So that's how rewarding it is. It's a non-clinical role, so I don't have to worry about that. So that's for me, that's been very, I needed that time for myself, from other things I need to do and all of that. So it's perfect for me. Some other people might not see that. I'm like, oh, I don't like the slow paced, I want it fast. So it's choice really, what you want to do. There are other opportunities to combine clinical skills with public health competencies in the UK. So now this will get us into specialty training, really. In the UK, for doctors, there is now an opportunity to do GP training and public health together. There's a dual competent, there's a dual, it's a dual faculty now. There's that opportunity to do both of them together. So it depends. It depends on what you want to do. If you want to combine, clinical practice like GP and public health, then there's the opportunity now to go through residency training through that route where you do both of them together. So it depends on how do you access them? I think having the discussion about specialty training is a different conversation entirely, because it's a big topic and it's a big deal. It's not something we can talk about here and finish it. But just know that there are two job roles that you can only access by going through specialty training: consultant in public health and director of public health. So those are the only two roles you can only get if you've done the specialty training. And the specialty training for public health is open to medics and non-medics. So you don't have to be a doctor to do that. But if you want to do the one that has the clinical and the public health, you have to be a doctor for that one, because only doctors can go through GP training and have the public health competency too. So what's the best platform to gain data analysis skill? I don't think I'm the right person for this, really, because I don't know. Honestly, I don't know. Maybe if I ask my friend who's transitioned, but really, I don't know. Initially I thought it was just the modules he did, but apparently when we got talking, and I found out that he's actually done a couple of courses and stuffs in data analysis from Nigeria. So that also set him on a very good. And to be honest with you, data analysis is a very niche skill, and it's rewarding in the sense that there are quite a lot of roles for that. If you are a data analyst, public health data analyst, or even a general data analyst, or data scientist, the UK is your oyster, oyster, really, really. So I don't know what platforms.
So in terms of
maybe
platforms,
Ron, yeah.
In terms of platforms, again, if you're trying to pick up skills in data, for me, it's more of hands-on experience than actually sitting on a platform trying to figure it out. So I know platforms like Code Academy. So they've got a lot of courses on there that takes you through things like SQL, Power BI, Tableau, and even if you went to YouTube now to say, I want to learn data analysis, best tools or whatever, you see a lot of videos that tell you which of the key tools. Again, we've talked about Power BI, Tableau, and all of that. So, but the main thing is getting access to those applications and trying your hands on them to actually build dashboards. So, for example, you say, I'm trying to get into data analysis, or I'm a data analyst, and you have not built one single dashboard, then I won't take you. You're not a serious analyst, because I don't know what you're analyzing if you can't show me a dashboard where, even if it's something on Excel to show, okay, this is what I've done to, see the trend. This is what this, then like you said, interpret the data. Okay, maybe in the so month it's peaked. Okay, these are the reasons why I think it had peaked, or this is why, based on the data set you're using. And again, there are also a lot of freely available data sets people can practice with. I think the popular one I used to do then when I was thinking with data analysis is Kaggle. So if you go to Kaggle, there are lots of data sets on Kaggle that you can, download freely and use them for whatever projects you want to use. So I think for me, it's more of hands-on experience really than going through courses or platform, if that makes sense.
Yeah, I agree with you.
So somebody is saying, can we have an example or sample of how to write a supportive statement? Do you mean a sample of a supporting statement or what? I think that's from Simon. Probably leave that for now.
Okay.
If it's Then Brenda is asking, with 15 years in public health and MSc from the UK, how can I transition from a Nigerian state government role to international roles? Are there recruiters or visa sponsorship opportunities for experienced professionals?
So I think this is a little out of my scope, really, especially when it comes to international roles outside, except if you maybe come to come about like roles in the UK, but if international roles, I'm assuming that's like the World, the WHO, United Nations, UNICEF, UNESCO, those kind of things, places. Never say never. I know, interestingly, one of my mentors from Ibadan is a public health, has a PhD in child and adolescent health from Ibadan, got a World Bank job, not even WHO, World Bank, and is doing public health. So, and he got it from Nigeria, directly from Nigeria. So I think that really shaped my head and really helped me to think wide and out of the box. There's nothing that's impossible. It's how you position yourself and how you really, because if you've worked with the state government, you understand the politics of health. And that's very important, even in international, organizations, how much politics plays a very big role in, the health. So I would say that there's nothing impossible, but it's just how you position yourself. What rules do you want to go into on the international scene, and how can you show that competence? It's especially for international roles, and even every other role, is how much you're able to evidence and show that capacity for that role. So it's what you're able to do, really. With regards to recruiters, visa sponsorship, that I'm not very, it's not, I'm not an immigration lawyer, so I really don't know. I really don't know, really. Yeah.
That's fine. Thank you. And somebody said, how about someone that has absolutely no experience, both clinically and in public health? What would the person even grasp at to get a foot through the door?
So now this question, I would like the person to put a context to it.
Yeah.
Is the person already in the United Kingdom, or is the person back in Nigeria? Because if the person's in the United Kingdom, it's different. And okay, I'll give an example. So I remember somebody here spoke. It was I can't remember who the person's was. Kedi, I think it was Kedi.
Yeah.
The public health graduate route.
Yeah.
In the UK, there is what we call the public health apprenticeship route. So what it means is that people who have no experience in public health, as long as they are citizens and they don't have any issues with it, they don't have any restrictions with their immigration status, really, they have the opportunity to pivot into public health. So they will go through an apprenticeship program. And that's, I think, even from outside of public health, quite even that's the direction in the United Kingdom now. A lot of, courses are going through the apprenticeship route where you're working and you're schooling. So at the end of the day, at the end of 3 years in public health, you have a degree from affiliated university, and you also have that 3 or 4 years work experience. And at the end, you also get to be registered in the United Kingdom Public Health Register, UKPHR. So that's for people that have, they don't have any restrictions on the immigration status. Really, that's what it is. That's what available for them. So that it's very possible for you who have no idea with clinical or whatever public health to come in through. You just need to show that interest, and you need to show, the relevance to yourself as a person, as professionally. That's what it is. But if you are not in Nigeria at all, if you're in Nigeria at the moment and you want to not get into public, I'll tell you, get involved in anything public health. Yeah, that's what it is. If you want a foot in the door, eventually you want to start making the moves. So start getting involved across, from your local government, state government, charities, outreaches, even in universities where you are, start making that connection, start working, start volunteering, start doing things in public health. So that gives you an idea. Because once you've done that kind of thing over a while, time, it can really give you, direction of what exactly you want to do. Then if you're in the UK and you've not done anything public health, clinical, and you want to pivot into public health, and you have some restriction with your immigration status, I would say start anyway, start volunteering, start showing interest. One of the organizations I would say you should go to is Health Watch. So Health Watch is it's like the community outreach arm for the ICBs, for the NHS ICBs, and they're in every city in every local authority in the country because they help with a lot of community engagement and all. So I think go speak with them. Once you have that interest, really, I'm sure they would, even charities, the health focused charities, just try to have that. That's the way you can have your foot in the door, really. I don't know what else you can do, really, but that's it.
I think you've summed it up really nicely in terms of the strategies. I hope this is useful I don't know who that person is, but that's fine. So thank God is saying, we'll just quickly run through this. I think we've shot past our time, really. So thank God is saying, thank you so much for this presentation. Currently have a bachelor's and master's in public health from Nigeria. However, we're still facing the challenge of having good public health, structure in Nigeria. Because how can I transition to the public health field in the UK? Would doing a PhD be necessary?
So I'm looking at the question again and seeing where angle they're coming from. Because I feel, once you already have a master's and bachelor's, public health from Nigeria, and you recognize that there are no structures, so I think that's a very good place to start from, really. Contribute your quota however you can, contribute your quota, start doing something, start leveraging on your network, start speaking with people, start going for conferences, doing things, wherever you are, start, just get working. Don't just look at it and recognize. It's one thing to recognize, one thing to start actively doing something. Then how can you transition into public health field in the UK? It's by applying. That's the way to transition, really, to apply. And because there's no point. You already have a master, so I'm not going to say come do a master's. The second master doesn't make any sense. You already have the qualification. So what you need to do is start applying. Now, would a PhD be necessary? It depends on your context, on individual context. I cannot say yes and no. I have it for myself. I would say there's pros and cons for PhD. But if you want to come into the country, and you think, oh, this route would be good for me, I can go in through academia into the industry. Okay, which is good. It's a very smart move, but you just need to weigh the options, right, really, because I'm very careful in this statement I want to make. At the very top of academia, public health academia, the mobility for them is very beautiful. Once you get to the very top, as a professor, as an authority in academia in public health, the mobility is very small. But before you get to that, top parts, the very top of academia and public health, the other parts, the mobility, I might be wrong. So I'm going to put this caveat. I might be wrong, but what I've seen, the mobility is very restricted. Yeah, in academia, especially when you're on that journey to get into becoming that authority, get into that level. So I would say, and the amount of years you spend out of the industry, it takes, because having a PhD is not an essential criteria. Even having a master, okay, maybe recently having a master's is not added everything, but having a PhD to work in the industry in the UK, it's not an essential criteria. I've never seen it there. So most people that have a PhD just have it as an added advantage. It gives you that, extra rigor, research rigor. You makes you right. Nobody questions when you talk about evidence and data. Nobody talks about it. But without that, you don't have to have it. So I would say weigh the options. If that would give you a legal status into the country, and you can plan, that's a smart idea. It depends on what you want to do. So I wouldn't say, not don't do it or do it, but it depends on what you want to get out of it, what you want to do, how do you want to move. It takes a lot of planning, to be honest with you. A lot of, you need to really plan. Yeah.
Thank God. I hope that is helpful, really. Let's see. Someone is asking, what are salaries like for entry roles compared to clinical care?
So for entry roles for public health, it's in the range of the 30 to 40,000 per year. Those are entry roles, public health roles.
Yeah, and I think this information is very readily available on
Everywhere.
NHS jobs. So
Yeah.
every role you look at, you just see the banding.
Yeah.
I think
Yeah.
I'm trying to do a video on that, but I haven't had time to sort it out. But yeah, it's really open out there. Then somebody said back in school we use SPS for data analysis and Qualtrics for questionnaire. Are there any better softwares to use, especially for data analysis? Again, depends on the type of data you're dealing with. Are you dealing with very large data sets or small data sets? But again, I tell people your basics should actually start from Excel. You know, understand Excel actually does a lot. And to be fair, people, if you're not like a proper serious like public health data analyst, then Excel should solve most of your basic issues you
Yeah.
need to move around the data. But if you're not
Yeah.
like proper analyst, then that's where your SQL skills need to be very sound because you now have access to very large data sets. You need to be able to write queries to find whatever you need and then Power BI or Tableau for visualization. So I think off the top of my head, those are the ones I'll
Mm.
probably mention now. Then is having a full UK driving license an essential requirement to securing a public health role in the UK?
No.
No.
And the reason I'm very fast in saying no is because I've had quite a number of people ask me these questions in my LinkedIn DM. And I understand the fact that you see it in your job description, but having a full driver's license is not an essential. What is essential is you being able to move around. And once you can move around, however you decide to move around, whether by Uber or by taxi or by bus,
Just
by
move.
train, that's your own cup of tea, really. But can you move around when you need to move around? Yes and no. So, because personally, so I'll just say myself, I don't have a full driver. I don't have a drive. I haven't driven in the UK since I arrived in the UK. I'm at the top of my career, and it has not at any point deterred me. It's never a conversation in interviews, really. You know, of course, I know how much I'm having to spend on transportation. So that's a personal cup of tea. I would deal with that, but it doesn't deter you from getting your job. It never. Maybe when you see it, you can say, "Oh, I don't have," because the way I respond is, "I don't have a full, but I'm able to move between places at the time as required by by the job." So, and that's enough. Once you can take responsibility like that, that's fine. Really.
I hope that helps. Then even myself, I don't have a driving license, so
So we are plenty.
yeah, we're plenty. I think the last question is Nigeria qualified MPH eligible for clinical residency training in UK without the hassle of UK exams? How long does it take? I don't
This
think
question, this question is so clinical residency.
so. I assume this is looking at things like maybe internal medicine, specialization, something like
Exactly.
that. So no,
Exactly.
you wouldn't be, you have to go through the normal
Yeah. You have
routes.
to write the exams
Yeah, you have to write the exams to get into training.
to training.
So
Yeah.
there are no two ways about that. Let me see. There's no other question. Any other question before we just sign up? It's been a long evening.
Yeah.
I guess not. So probably say thank you everybody for attending, those who've stayed to the end, and thank you so much, Dr. Clifford, for giving us some of your precious time. We can't pay
It's my
you,
pleasure.
but thank you very much. So later the recording will be available when finished processing. Then I'll just send out an email and you guys can watch it and pick up. So I'll also share his LinkedIn profile. You can reach out to him if you have any other questions that I might not have covered here or you didn't think about when we were on here. You can just ask him. He's a public health expert. I'm not in public health. So I know he's more than always happy to answer all of those questions. So thank you, everybody, and I'll see you guys in the next episode or webinar.